This video is specifically for incoming interns, meaning you're finishing med school, you just matched, you're actually probably relaxing, watching a lot of TikTok because you're pretty much done with med school and residency has not yet begun. There are two pieces of advice that I was given that helped me immensely, and I think I should pass them on to you. I still use them to this day occasionally. Now that I think about both pieces of information that I've held on to, I'm a pretty impatient person. I like to get things done. Probably why I became a surgeon. Anyways, here are the two pieces. The first, treat every patient as though they were your grandmother. Get at the root of the problem, do all the investigation, don't take any shortcuts, treat them ethically, do the right thing always for them, regardless if you like them or not, if they're being ornery, or if you're in a hurry. Second rule, when there's a concern about a patient, always think about the worst possible thing that could be happening to them and then work backwards. That way you don't miss anything. For example, I'll never forget, I was told this by a chief resident when I was an intern, and it came in handy like the next week. Had a patient on the floor, recent post-op, had had general anesthesia, had a history of COPD. The nurse called me a couple hours later and said that the patient was fairly agitated. Rather than just thinking he's a ornery old man, I started with the worst thing that could possibly happen. Is he retaining CO2? Is he hypoxic from the recent intubation? He already has a history of lung disease. So rather than working up the ladder, I worked down the ladder. We got an ABG. RT helped with that, and guess what? He was hypercarbic and actually required reintubation and transfer to the ICU. Never dismiss things and always assume something bad is happening and rule those things out until you get to the right answer.